Hello, everyone, and welcome back to the Health Equity Chats podcast. In this episode, we are highlighting youth voices in public health and the minority health consultants firm. I have their official logo right here. And then we'll be discussing various topics such as advocacy and the role youth play in public health. And then we'll also learn about the awesome work that the minority health consultants firm does with their official owner and founder. So I'm Grissel, a health educator here at the Southern Nevada Health District. And I work in the Health Equity Program, where we promote the highest level of health for everybody in Las Vegas and, of course, statewide. And today we are joined by a really great guest star from the Minority Health Consultants firm, and then I will let them introduce themselves.
Hi, everyone. My name is Alisa Howard. I'm the owner and founder of Minority Health Consultants, a public health, social impact, and wellness firm. And I've owned that for about 8 years now.
Oh, that's awesome. Thank you so much, Alisa, for being here with us and being able to share with the listeners. I know we're super excited to learn about the Minority Health Consultants firm, the initiatives that they have, and then also, learn a little bit more about advocacy and health equity that the firm also, has initiatives for.
Perfect.
And then before we jump into kind of like the main portion of the podcast, I'd like to also promote our previous podcasts, which now contain closed captioning for other languages such as Spanish or French. So again, those are on official SNHD webpage. So Alisa, for our first question for today, can you tell us a bit about yourself and how you started off in the field of public health?
Oh, wow. So
I know it's a bit of a weighted question.
Yes, I'm like, that's a loaded question. 13 years ago, I received a call from a friend at the state public health office. It's the OFI office, Office of Public Health Informatics and Epidemiology. And I was in school getting my bachelor's degree. I was in my last year, and a friend said, "Hey, we're looking for an admin, and I know you're in school part-time. Do you want to, work part-time?" And I'm like, "Work where?" And she was like, she told me where she works, and I was just like, "Do you guys deal with blood?" And she was like, "No, we're in an office." And I said, "Sure, I'll come in for an interview." By that time, I had already had my communications associates and my paralegal associates. And so I had already been working in the field of law and all of that, but I was looking to make a switch, and hence me going back to college. And I came into the office, and upon my interview and the manager seeing that I've been a paralegal for 3 years, I've written a book by that time, a poetry book, and I've done editing and things like that. They were like, "So we were going to ask you if you want to be the office assistant, but I think with your skill sets, we want to know if you can work in our tuberculosis department."
Oh, that's a big jump, right? That's a big
jump.
I
was like, "Tuberca who?" I had no knowledge about public health, a lot like our public, right? Literally never heard of it, didn't know anything about it. Our colleges don't talk about it. They don't tell you that this is an avenue you can go into. Never thought I was interested in health in any kind of way, because I thought it all dealt with blood.
Yeah, that's like that association, right?
Yes.
You hear health,
blood. And I was like, no. And so that's how I got started. I started working in the tuberculosis department as the policy and procedure writer. And so I wrote their toolkit, rewrote their toolkit, and stayed with them for about 2 years. And then I started working at the health district part-time. So I had a part-time job there and a part-time job with the health district. And it was a mutually agreed thing that I would leave there and then come over here. And I worked in the HIV department. It was Office of HIV at that time, and did some work here for 2 years, worked in a sexual health clinic, did all of those things, and then was asked to go and run an HIV department for the minority communities at the Las Vegas Urban League. And so from there, my path just kept on going, and I ran a Ryan White HIV program for 3 years. And then after that, because of just political things, HIV funding kind of went away in 2017-ish. Not went away, but kind of got moved around. And so my department did not get funded. And so that's where I said, you know what, like, I still need to do this work. There's still so much work to do. I had about 89 people in my program, and I felt like those people were just being sent away. And so I wanted to still make sure that equity was at the center. So I started my own firm. And then I started working with the health district, and I started working with Intermountain Health and American Lung Association, and all these different entities to bring health equity into their programming.
Oh my gosh, Alisa, it sounds like a really excellent career guide and going through that whole path, right? It's a lot of good stuff that you had. And then would you be able to tell me some positive outcomes from the various public health initiatives and programs that you've been a part of?
Absolutely. I think that everything that I do is positive. Just thinking about people and thinking about the health of people and the health of communities, no matter what color, race, gender, ethnicity you deserve wellness, and you deserve to be in good health, and you deserve health access, and you deserve whatever it is that you may be missing, right? We call them barriers to health. And so I think that all of the initiatives that I've worked with a lot of different entities on have all had that basis. I can't think of any particular ones at this time. Right now, I'm working on a maternal health initiative with Comagine Health, and just making sure that mommies and babies are good and taken care of and getting the adequate care that they need. As far as positivity, like I said, I think all of the work I do is pretty positive because it's all helping somebody.
All right, thank you so much for your response, Alisa. Yeah. I know, especially you were going through your experience. I'm like, it's really valuable, right, to be able to have this and being able to kind of be this pillar in a community and say, hey, these resources are available for folks. And sometimes I think a lot of the folks might not know, hey, I didn't realize this program was available. You know what I mean? So it's super important to be able to have that and say, hey, this is what we have for folks. And I really love how you're able to really reach out to folks and then especially kind of go into all the community-based organizations and really form those connections.
Yeah.
And then to kind of jump into like the details from the minority health consultants firm.
Sure.
Because how did you implement public health practices, and really can you guide us through how the firm started? What was your initial motivation for starting your firm?
So the motivation is based off of, the HIV program that I was running at the Las Vegas Urban League. Ryan White funds got pulled from the state level and then from the federal level. So for me, it was about continuing that work that had already been done. Like I said, I had about 89 people that were in that program. I had staff. And so I wanted to make sure that people were still that had HIV or living with HIV were still being heard, still being seen, and still getting the care that they needed. So I started my firm. It's a for-profit. I didn't want to start a nonprofit at that time, but I started a for-profit and just started consulting. And I just started working with HIV programs that I already knew, that I already had partnerships with prior. And so it was a little bit easier for me to get in that way because I already had these relationships built. And just for the initial start of Minority Health Consultants, I didn't know what it was going to be at first. As an entrepreneur and as a business owner, it was just kind of like one of those things where you just jump into action. Something happened, funding got taken away, and you know that you need to make impact still. And so it was just like, okay, let me Google how to start a business. Let me see what this looks like. And I had to figure all of the business stuff out along the way. But it's a great experience for anybody that has that drive to want to continue helping. If your funds get pulled, it's really important to find a place that you can go that's going to allow you to still do that work. But if it's not a place out there, start your own business and do it. And people that know you and know that you have your heart in the right place, they will fund you. And so that's kind of where that all started from.
All right, thank you so much, Alisa. So you heard here, folks. If you have that drive, please feel free to start that business. And kind of with that vein in mind, could you be able to take us through the process of kind of how you started the business? I know you mentioned you were Googling kind of how to start up this, but what steps did you take, and what steps might listeners, hopefully help to replicate?
Yeah, so like I said, I Googled how to start a business, and it gave all these steps, and I said, this is a lot.
I know, it's a lot of stuff that comes up.
And I was like, the wording and everything, if you're not in that world, I knew a couple of things. Obviously, I've been a director of a program before. I knew budgets. I've written policies and procedures. I knew some of those things, but the actual starting of a business, like getting on the Silver State Flume, Silver Flume for the state of Nevada, getting on that, starting an application, what name do you want? All of those things I never thought about. I was just like, I just know that I want to do this work. But I know that the name came from the program I was running was called Minority Health Services. And so I just changed it to Minority Health Consultants. So it was just like, that was easy. But other than that, I called LegalZoom afterwards. And I was just like, so I'm on this Silver Flume website and I don't know what to do. Because it was asking questions, not just like your name and all of that, but are you a DBA? Do you want to be an LLC? And I'm like, I don't know.
There's a lot of acronyms, right? That start popping up.
Yes. Like we have in public health, right?
Yeah, love
and
them.
I was just like, yeah, this is not my forte. So I called LegalZoom. LegalZoom will get you together. You pay your fee to them or whatever, but they will go, they have access to all of the states. They know the laws of each state, everything. And so the guy just went through the questions and asked me, and he was like, for you not to, at the very end, he said, for you not to, wanting to do this on your own, he was like, you pretty much knew everything that you wanted to do. And I was like, yeah, I had it in my head. So, yeah, that's how that kind of got started. So, for anybody out there, if you want to start a business, you can do it on your own, going through Silver Flume, State of Nevada business website. But if you don't want to do it on your own and you need some questions asked, LegalZoom is a great resource.
All right. Thank you so much, Alisa, for walking us through that process. Again, LegalZoom is a place to go to really get your stuff together for the little business area.
Yep.
And then before we jump into some health equity questions, I'll give us kind of the official definition of health equity. I know sometimes it gets kind of tricky to grasp the concept, especially when we throw in equality too. So sometimes folks get those confused. So health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. Again, that's kind of a big, huge definition that we have. And then with that definition in mind, let's jump into some health equity related questions, especially how they pertain to your firm. So how does your firm incorporate these health equity practices?
So I only work with stakeholders who have a health equity initiative. So one that's just the kind of core of who my business is people who want to bring health equity to minority, vulnerable, neglected communities. And so that's just the core of how I even get business, is working with different entities, programs such as at the Southern Nevada Health District that already have those in place. So that kind of sets me already up for a good, health equity, to incorporate health equity. And then as far as my actual business, how I put health equity in order is I give back to the community through a grant that I have with the Public Health School of Public Health, and that's for minority communities. That's for people who don't have access to college, and maybe this is their first year. So social impact, that's what I consider that as, entrepreneurship as social impact. And I bring in students and I bring in people of color, people who come from these communities, so that I don't think that I know everything, but I bring in people who know more about their communities than I do. Then that way, if we're working together, we can work equitably on the initiatives that my stakeholders give me. So my work comes from, like I said, different entities who already have grants that already kind of have health equity in there, pieced in there, but then I come and add that health equity piece once they partner with me, and I get a sub grant or something like that, or a contract, and then they tell me this is what they need, and then I give basically I consult them on what I feel like they also need. So just showing like, hey, maybe we can do this, and maybe we can go work with this community. Maybe we can go work with this entity of people, bring these people in. So just incorporating things in that way. So like I said, usually the grants have an equity piece in there, but I just kind of add on to it if I see that a certain group of people or population is not being addressed.
I thank you for your response, Alisa.
Yeah.
And then I know you mentioned you have the grant for the students. How might students apply for that? Is that only, I know you mentioned through the School of Public Health. Is there an application process that they can look for?
So they can just go on to the UNLV School of Public Health website. So just go on unlv.edu, look for School of Public Health, go under their scholarships, and it's called Minority Health Consultant Scholarship. It's for first-year students receiving their bachelor's degree in public health. And like I said, just the qualifications are you just have to come from a minority-based community. And just for definition purposes, minority is not just race. It's also disability. It's veteran status. It's, youth. It's women. There's different sections of minority. So people hear that word usually and they just think of color, but that's not really what the definition of minority is. So it's open to a lot of people. But like I said, my cause was I wanted to give back. I accidentally got into public health. So for people who want to really be in public health and they knew that from the start, I want to be able to help them with their first class or their first couple of books or something like that. So
Oh my gosh, Alisa, it really sounds like it's really about fostering, right, the new wave of public health, those young folks. So again, you can look for that in the official pages for the UNLV. And Alisa, how do you bridge those gaps between stakeholders and communities? I know you were kind of touching on in your previous answers, but maybe could you elaborate a little bit more?
So it just depends on the grant. If I get a grant for instance, I have had a grant with the chronic disease department for flu vaccines and flu information and education. For that, my initiative was to go work with the churches. I have a really great relationship with African American churches. I also have a really great relationship with just the Hispanic communities and things of that nature. So, like I said, if I don't know the answers, I have people and friends that I can go to. But just showing the stakeholders that, hey, I have this reach that you may not have because I'm out there in the community. I don't have a typical 9-to-5 where I'm sitting behind a desk. I'm actually out there doing the work. And so that's kind of what brings stakeholders to me, one, but also how I'm doing the health equity piece of that is, like I said, maybe consulting on like what it may look like if we're working on a contract together, like, okay, we have this grant for flu and education, and I'll read it over and I'll think of some things that maybe health equity wise that they may not have thought of. And that's for anybody. That's for HIV. That's for, I've had a teen pregnancy prevention grant with the health district. So basically I tap into the communities that they may not think about. And that is what brings the health equity part is because there's so many different populations of people in our city, but also in our state that maybe people aren't thinking about. And it's not done intentionally. A lot of times is what I notice. It's done just because we don't maybe see those populations of people or we don't hear too much about them. And so not leaving people behind is really what I'm big on. Not finding those communities that need the help that they deserve and tapping into that. So that's kind of how I work with stakeholders.
Thank you so much for your response, Alisa. That's super important, right? To be able to identify these communities and be able to really say, hey, we're here for you. We have resources for you. So I think that's really awesome work that you've been doing with your firm and with your consulting as well.
Thank you.
And then I know you mentioned that you've been working in the field of public health for about 13 years, and then with 8 years, focused on the youth health initiatives through your firm. So really, what initially drew you into the youth health work, and how has your motivations kind of evolved over time?
So this kind of goes back to, again, my why I even started my firm. In the previous director position that I was in at the Urban League running that HIV program, one of the service lines was youth. So youth have the highest rate of HIV. And so I brought that over to my firm when I started my firm. I still wanted to focus on the populations, like I said, minority populations, which does include the youth because they are a minority group of our population in the U.S. I still wanted to include them. So the work that I did in HIV continued. So I still do HIV events. I still speak at HIV conferences and education. I still provide sexual health classes out to the community. And so a lot of African American sorority and fraternity groups will call me if they have like a youth event and they want to incorporate sexual health or healthy relationships conversations into their conferences or their youth events that they're doing. And so that's how I do a lot of those. I also recently worked with the city of Las Vegas where you all came to help me. And I was just called and said, hey, we're working with Batteries Included program, which is for minority youth that are, their parents work during the day. And so this is a summer program. Do you have any ideas of what we can possibly do for them in regards to their health? And I said, let's do a health fair. I said, we always focus on health fairs for adults, but we never focus on the kids. How do we get them to see what it looks like to go and ask for what you need, but also just have it out there and ask the questions that they need? So that's what we did for the city of Las Vegas. And we set up a room where it was different vendors. I called all of my friends and colleagues and said, hey, I need you guys to come and bring your goodies and talk to the kids about what it is that you do, hoping also in the workforce realm to help generate ideas for them to want to go into health and to go in, to keep the workforce going, right? A lot of them did come back and say they want to be nurses. After the doula spoke, a lot of them said, I want to be a doula. They didn't even heard of that word before. A lot of them were saying, I kind of already do this work and I didn't even know that I do it. One little guy, he had a little business on the side.
Oh, yeah, good for
And I was just like, he was already an entrepreneur. He was in like junior high school. But I encouraged him like to keep going. And then if he wanted to add that health piece, to let me know. And so, yeah, I feel like the youth are our future. I know that's really corny. Whitney Houston used to say that in her song. But I always remember it because they really are. If we really think of it and take the corniness out of it, they really are our future. And so if we're not preparing them, then we're not preparing ourselves for a good public health system.
Oh my gosh, you're so right, Alisa. Really, it's important to be able to support our youth, right? Yeah. I know, especially when we went out and we were able to teach these kids, it's really rewarding to be able to see, hey, these kids, their faces are lighting up and they're able to see, they might not be interested in the traditional medical path or nursing path, but there's also all these alternatives that also have health or public health in mind. So I think it's really important to be able to go out with the kids and be able to tell them, hey, this is available for us. And I really love how you kind of have that relationship with them as well. Yeah. And I'm one of those people, like, I wasn't told about public health. So I'm always thinking about, what was I missing as a kid, right? Maybe I would have gotten to this field, not accidentally. Maybe I would have wanted to go into public health. So to educate people prior as they're young and trying to develop their brains around what they're going to do in the future, I think it's important to even put that in there, People just think of, like you said, medical, dentists, doctors, the traditional things, but they don't think about our public health systems and all of that it touches, right? And then when you start going into it, like parks and, our speeding limits, things of this, they're like, what? Because they just think of health, but they're not thinking of holistic health and that public health touches so many different areas. Yeah, it's really important to be able to kind of have like that larger worldview, right? To be able to say, hey, sometimes the way your communities are built, even the way your sidewalks are, that's also a really huge thing in how your health is and how it all comes together. So I think it's super important. Yeah. And then let's just jump into some advocacy related questions. So for you, what exactly is health advocacy and what does that look like for your firm? So my firm gets involved with a lot of policy. I advocate for a lot of policy, the HIV modernization bill that we were doing back in 2021, 2022-ish, where we basically were trying to decriminalize HIV. And that's something that our state had never tackled before. And it's happening around the country. And so I got involved with Silver State Equality. Shout out to Andre Wade. And I got involved with the HIV Coalition. And which is a part of this bigger initiative. Again, having worked with these people probably for like 6-7 years at this point, it just felt like, working with friends on something that's going to benefit our whole community. And that bill was great. And I also worked on the community health worker bill, AB 191. And that bill was to allow community health workers to be a real field in the state of Nevada and get them Medicaid reimbursed. And so now that field, I've been working as a community health worker instructor and teacher at College of Southern Nevada for over 8 years. And I've worked for the CHW Association in that time frame as well. But community health workers really are those everyday people that are in their communities and they're already doing good work for their communities. They just don't know that they can bring it over here to public health. And so that's another health initiative and just advocacy of me showing other people how they can advocate for their communities. If there's something that your community does not have, a park, the speeding limit is not correct. Things are happening, safety-wise in your community. Those are public health issues. And so me teaching classes and showing just regular everyday people that may not have high school diplomas, may not have, all the fancy degrees, but they really want to help, showing them how they can get into this field as frontline public health workers. It just brings joy to me because it is something, again, that I never knew about. I was never told about. And again, for me, it's about education and educating people on the different paths that they can take in their lives. Also, it's a thing where I'm like, yeah, I'm getting older, so I can't do this very much longer. So I'm going to need to teach other people how to do this. Yeah, I think it's super important, right? And as someone who's initially started off as a community health worker, it's really important to be kind of say, like, hey, I know you folks are really, you're in the communities, right? You live in the communities. And this is something, you can go further with, you can study for, and then, you can get, paid for your work. So that's really important. Absolutely. And then I know you mentioned that you were a professor for the CHW. How would folks look into the program, maybe if they're interested in registering for the program? Yeah, so they can look on csn.edu's website, College of Southern Nevada, and look for their workforce development, workforce
Workforce Economic and Development Department. And they can contact Raina Zeldon is over there. Also, Casey Motley is over there. And I can leave some information if you all want to email them. But you just look on that website and then look for that department, and you should be able to contact those people and let them know that you're interested in a community health worker class. It's 8 weeks long. Our next one starts October 14th. And they basically, fill up. There's not a set stone of when the classes are. It's basically like when people are interested and when we have enough, when we have about 10 people or more. And so the next one is October 14th. And so, I would love to see you in there.
Yeah, it is really a great, excellent class. I was in Luis Hachevez's class before, and I really do say I learned a whole lot, and it really prepared me for my role as a community health worker. So again, highly recommended.
Luis was actually one of my students.
Oh my gosh, small world, small world. Yeah, he's an excellent instructor. They all are really excellent. And now, Alisa, for kind of a little bit of a heavier question, so how can youth-led programs effectively address public health issues such as substance abuse, mental health, and nutrition within their communities?
So the youth are, they're into all of these things. They're into our technology. They know more than us. They're on the webs, they're doing all of these things. And so they're learning good things and they're also learning bad things. Substance misuse is definitely one of the bad things that they're learning, right? But it's good for the information to be out there so they also know what the dangers are, right? For the American Lung Association, I had a contract where I was going out to African American and Spanish Latino youth and talking to them about vaping. And going to churches even and their youth departments. So doing non-traditional things, right? That's what this work is all about, is that sometimes we're so focused on doing the traditional route of everything that we miss, like I said, all of these other populations that are over here, all of these little pockets of people. And so going to the churches with a vaping program, most people wouldn't have thought of that. But I know churches. I've born and raised and went to churches my whole life. And so I know that they all have youth departments. And the youth pastors or the youth ministers are always very open to people coming and teaching their youth about things. And sometimes there's a spiritual disconnect where they're like, no, I don't think that topic should be brought up here. But for vaping, they even had heard about it. So vaping was one of those things where they're like, yeah, I saw my little grandson, he was vaping and I had to tell him about it, but I didn't know the statistics. So with me coming in and having that information, the youth were able to go back and now tell their friends, tell their family, right? If they're sharing a vaping unit or whatever with their friends, now they can say, hey, man, I can't do that because I just learned from this girl that just randomly came into our church that vaping has all the 2,000 chemicals in it. And these things do this, this, and this. And so I think when you educate the youth, they're the best sponsors for themselves because they're going to go and tell 15 of their other friends. Just like they're going to tell good stuff, they're going to tell bad stuff too. And so that's where the health equity piece comes in with youth, is they are a set of population of people that we still need to educate as well. We think of them as, oh, they're so small, they're so young, they can't take in this information. Well, those same small and young people that we're saying we can't educate are also having sex. They're also, having STDs because of that, not educating them on STDs and STIs and not wearing condoms. They're also, God forbid, having babies at young ages because of the lack of information that they're getting from adults. Because we're so, we want to baby them. And education is really the power. So anytime you educate somebody, you've educated not just them, but a whole group of their friends and their family members.
Yeah, definitely agree, Alisa. Being able to really provide that valuable education to folks, right? Being able to say, hey, these resources are here if you want to learn more, if you want more information. It's super valuable to have, right? Yeah. Knowledge is power is the saying that everyone always uses, right?
Yeah,
so
and sometimes important. It's about educating them, and they go and talk to their parents about it because the parents haven't talked to them about it first. Now it opens up a whole discussion at home, that they would never have had because the parents. I've talked to so many parents where they're just like, I don't feel comfortable bringing that subject up. But you found a vape in your son's pocket, but you don't want to talk to them about it. And maybe it's because of the lack of information that the parents have as well, right? So it's also just about, yes, you're educating the youth, but the youth are, their parents are also being educated at the same time. And you've opened up a dynamic between their family that maybe they would never have been open before.
Yeah, that is really, really true. And then kind of in the same vein of that mentorship and then with the peer support. So in what ways can mentorship and, of course, peer support networks strengthen the impact of youth-led public health initiatives?
Okay, say that again.
No, it's kind of a big old mouthful. So in what ways can mentorship and peer support networks strengthen the impact of youth-led public health initiatives?
Okay, so mentorship is so important. As a mentor myself, I believe in mentorship. It's everything. I had a mentor when I got into college and just along my path in public health, and I can just think of all of the things that they've told me that other people did not tell me, or I would never have found on my own. And so mentorship, that's so impactful when it comes to health equity initiatives, because mentorship is going to help the person develop themselves, right? Whether it's professional for the health educator to go and mentor a child or youth, but also for that youth to see, like, it's okay to be mentored. It's okay to listen and look up to somebody else. But also the peer support piece of that, like I said, youth always talk to one another. Whatever the subject is, public health wise, they're always going to talk to each other first. So that peer to peer is so important. And sometimes if we miss that piece, if we're not telling them it's okay to go talk to your friends about this is one of the things we want you to go talk about, then they don't know that, okay, I can have an influence on my friends. And so when it comes to health equity is, I'm going to teach you something, and then I want you to go teach somebody else. I call it the each one, teach one method, right? I teach you, you go teach someone else, and it keeps going. Now equity is being spread through places and people that we would never have touched or we may have never even met. So for that mentorship piece and that peer support piece is really important to know, one, that mentorship is something that youth need, but also it's good for them to see that they can be mentored, right? And that it's okay. It doesn't look, what is the new words these days? Not cool. But the peer support piece of that is really important. Just like as literally there's a peer support specialist job, right? So when adults get older and unfortunately they've gotten into substance misuse or something of that nature, peer support has been proven to work. So why aren't we doing it with our youth?
That's a really good point, Alisa. Really excellent in being able to offer that mentorship to folks. I know I had a mentor when I was in finishing up my undergrad studies, so shout out to Dr. Kate. Yeah. And she was really essential in being able to guide my process, and then she would even send me information about the Southern Nevada Health District, and she would say, hey, maybe you should look into applying, or you should look into getting ready for these positions. So it's super essential, right, to be able to have that, I believe, that guiding force, being able to tell you, hey, this is what you could do. These are the resources that folks have. Yeah, because mentor is different from your parents, right? Most of the time we don't want to listen to our parents. Unfortunately, they're different than our parents. They're kind of like our peer. But they may be on a higher level, obviously, but we may look up to them in some type of way. And so they just seem to have an influence on people, right? And I think mentors need to come in all ages and sizes and everything, so that they're just there for people and saying, yeah, I'm willing to take you in underneath my wings. I do that a lot through my business. I actually just finished a mentorship. I have to, because I do own a business, I have to be very critical with, okay, I can do this mentorship for 2 months. I can do this one for, just so that I'm not overloading myself. And all of my students and all of the people who have come to work for me, I've always said that I've provided a mentorship piece. I did not know it because I just naturally mentor people. But they told me no, you're such a great mentor. And I was like, I didn't know I was being looked at that way. So now I call it an internship / mentorship because of what they've come back and told me. And so, just being able to give people information that they may not be able to find somewhere else on their own, or give them advice that maybe they would listen to and just take in consideration. Right. I think that's super important. I agreed. It really is important. And Alisa, thank you for the awesome conversations today. So as we're wrapping up our podcast, so I'd like to ask you, what advice would you offer to young individuals interested in pursuing careers in public health?
So if I could go back to my young self, I would say explore options in public health. If you think that, I'd love to teach, and you think that doesn't fit in public health, it does. If you think that I love numbers, I love statistics, and you think that doesn't fit in public health, it does. There's a part of public health for everyone. People who are readers and writers, and people who are creative, such as communications, right? Just there's so many different areas of public health that you can work in, and we all make a difference by adding our skill sets to the table and being able to, just think outside the box. I know that's so, traditional for us to say that, but we really do. We really have to get outside of this box that we put ourselves in and start thinking, how would I like to be treated? And so if you're a person that wants to help people, this is a great field for you. And like I said, I came from law. I came from law, and I came from taking psychology. That's my background, a psychology bachelor's degree. And so being in this field has just shown me that you can get into this field without having a public health degree. But if you already know that you like public health, just go right into it. Go to the UNLV School of Public Health, look for my scholarship. And yeah, we would love to have new people in public health.
All right. Thank you so much, Alisa, and for sharing about the awesome work that the Minority Health Consultants firm does. And thank you to our listeners for tuning in for today's episode.
And thank you for having me.
Oh, yes, of course. And so please look forward to our next podcast, which will be posted on our official SNHD YouTube page. As always, please stay healthy, Clark County.